All right, now joining us for a chat is Claudia Chender, leader of the NDP here in Nova Scotia. Claudia Chender, thank you so very much for doing this. We appreciate your time.
Thanks for having me, Todd.
All right, so read a bit of this from the Chronicle Herald this week as well. Health officials made best efforts Tuesday to tout improvements in doctor retention and ER closures in Nova Scotia. The Liberal and NDP members of the Legislative Health Committee were not buying it. So lots of information from Karen Oldfield, interim CEO of Nova Scotia Health, saying that the numbers were good when it comes to recruitment, net gains overall, and they're making a dent when it comes to surgical wait lists and other metrics. What's your response to all of this?
Well, I mean, I think good is relative, right? So absolutely there's work going on at the Nova Scotia Health Authority. And they are recruiting doctors, and they have an announcement every single day. I know those come across your desk, Todd. But the question is, are we moving the needle? And so what I do is talk to Nova Scotians across the province. And the folks that I talk to are worried about the same thing today that they were worried about 2 years ago. They're worried about finding and keeping a family doctor, or at least being attached to an office, whether that's a nurse practitioner or collaborative care. And they're worried about being able to get emergency medical care when they need it. So especially in rural Nova Scotia, getting to an emergency room that's actually open, calling 911 and actually having a paramedic show up. And, you know, all of these things continue to be in a very precarious state, frankly. So are there good news stories? Sure. I mean, you were talking about government finances. The government's spending a lot of money on healthcare. I hope they have something to show for it. But the reality is that for most of the people on the ground, we're not seeing big changes, and that's what we were promised.
All right. What about just basic transparency? Do you feel as though that there's enough transparency from this government and from the health authority under Karen Oldfield's watch?
Well, I think this government has a massive transparency issue. So you were talking about the swing in revenue from taxes. You know, the overall swing in government revenue is much higher than that. They probably took in an extra over $1 billion from what they had forecasted themselves last year. They spent $1.7 billion of all of our money without feeling the need to tell us how or why or to get approval to do that. And, you know, that might be lost on folks as sort of a boring detail, but $1.7 billion is a huge amount of money. And this government has said repeatedly, we're the only province in Canada that doesn't require transparency for that kind of spending, that doesn't require some kind of legislative oversight. We have a whole budget process we go through every year. You know, this government gets up over and over again, even when the AG says this is a terrible practice.
Yep.
It's not a good thing to do for Nova Scotians, and they say we don't care. We're going to do it anyway.
Yeah, I was going to mention Kim Adair recently brought that to light for sure. Okay, so you've had some one-on-one conversations with the health minister. Is that correct?
That's right. Yep. My colleague Susan LeBlanc, the health minister, Emily for Dartmouth North, and I had the opportunity to meet with Minister Thompson this week.
All right. How long did that last, and who initiated that? And that's a good thing, right? That you're having those conversations. Absolutely.
So in the last legislative session, I asked the Premier about a Freedom of Information request we had received that showed that Nova Scotians were dying at an increasing rate in emergency rooms. And I asked him, you know, much the way we started this conversation, what are you guys doing about it? Like, what's the plan? And in his response, he said, if I thought that you actually cared, we would walk you through all the things that we're doing.
Wow.
And
wow.
You know, so afterwards we said, hey, guess what? We actually care. So we'll take that meeting, thanks. And you know, to their credit, they set it up. And listen, I have a lot of respect for the health minister. It's a hard job, and she's working hard. And so she did take the time to walk me through a number of, I think, good projects that the Health Authority is working on around seniors care, around various things. But, at the end of the day, what I'm looking for is an answer to the question that people are asking me, which is, when am I going to be attached to primary care? And when is my emergency room going to be open? Like, how do I know I'm going to get emergency care? Mm-hmm. And I, unfortunately, didn't really get an answer to those questions. And those were the questions I went in with. So it wasn't that they're not doing stuff. They're doing stuff. They're working. But, I think we need to have a real laser focus on the things that really make a difference to Nova Scotians and that are going to move the needle in healthcare. And we sort of see the opposite of a laser focus. We see an announcement every day about a different thing. We see a ton of money going out the door. Mm-hmm. But at the end of the day, we're not seeing the changes that we were promised.
All right, so you say laser focus. I'm going to ask you for laser focus. Give me some more details because, look, healthcare is very broad. There's tons of moving parts. You know this as well as anybody. So what would you be laser focusing on?
Well, I think, what I'm hearing at the national level is that the model for the future is, listen, we have a huge healthcare human resources issue. And when it comes to physicians, it's not going to be like it was for us or our parents, where everyone is always going to be able to get in and see their own family doctor. We know that. But, the NDP was very forward-thinking, and we were the ones who brought in the collaborative care model. So, a doctor's office doesn't just have to have a doctor and a staff. A doctor's office can have a bunch of different healthcare professionals, including nurse practitioners and nurses and other kinds of specialists, so that when you go there, you don't have to see the doctor, but there's a place that has your file that follows you. I think we should be laser focused on setting as many of those up right around the province as possible and making sure that people are attached to primary care. So this government likes to say, well, now we have pharmacy clinics and we have mobile health, and all of that is good. Listen, I have kids. I have a kid with an ear infection. The fact, that can be diagnosed in all kinds of places now, and that's a good thing. But if I had a kid who might have cancer, I would want my kid to have a doctor. Mm-hmm. And that's, or be attached to an office so that they could get a test and then we could see what that test said, and then we could get another test and we could see what that said, and we could be navigated through the healthcare system. And that's missing for tens of thousands of Nova Scotians. I think that has to be a huge piece of our focus.
All right, so Claudia, is it about simply remuneration, how we remunerate doctors? Is it about cutting red tape? I mean, what are the ways in which you would entice doctors to work here?
Well, I think that everything I've heard is that the new agreement with Doctors Nova Scotia and the province is a good one.
Yeah.
And I think that deals with remuneration and it deals with other things. I mean, time will tell. It's new, but everyone I talk to is positive about that deal. And so I want to be positive about it too, because I hope that it works. But I think it's a system piece as much as anything else. So it's like, where are we going to put our resources? And I guess what I'm saying is, I think if we build out those clinics in a permanent way, as opposed to siphoning a lot of resources towards temporary pop-up Band-Aid solutions, we're going to end up with people being attached to primary care. Right now, it's much easier for a physician or a nurse or anyone to work in virtual care, where they can log on at 10 a.m. and log off at 3 maybe, and not have files to take home and not have a caseload of 2,000 patients, right? Mm-hmm. It's not that we don't want that, but it's that we want to incentivize people to be setting up permanent practices and to be joining those practices. And I don't see that effort happening at the scale that I think we need.
Okay, so what is the scale that we would need?
Well, I think what I want to hear this government say is that they are committed to those, 140, I don't remember the exact number right now, 1,000 Nova Scotians actually coming off of that need a family practice wait list. But we don't hear that. We hear things like, oh, well, episodic care is fine if you're young and healthy. Well, you can go from young and healthy to young and unhealthy very quickly, right? So I don't actually think that episodic care, so not being attached to primary care, I don't think we should think that that's fine for anyone. Mm-hmm. I think that the number one goal should be for everyone to be attached to primary care.
So you mean one patient, one doctor?
No, I don't mean one patient, one doctor. I mean one patient, one practice. Mm-hmm. So like I said, a practice, I'm in North End Halifax right now. North End Community the Health Center is the model, right? Mm-hmm. They've got nurses. They've got a doctor. They've got nurse practitioners. They have all kinds of other people. So you could go there, and if you don't need to see a doctor, you don't see a doctor.
Right.
You see whatever healthcare professional can help you, mm-hmm. but your file is there, and they know you. And so if your condition is escalated, then, the next time you do see the doctor. Yeah. So not everybody sees a doctor, but your health information and your file live in a primary care home where that follows you, right? Mm-hmm. And so that if something bad happens and you need that more direct care, there is an office that is following your care.
All right, so we're almost out of time, but so the funding model and the business model for that type of venture that you're talking about, that type of clinic, that would require a rethink to a degree, or is this, or do we not reinvent the wheel and just look where this is already happening?
I think we don't reinvent the wheel. I think it exists here. I think that we have this model in Nova Scotia. I think that we already are, to a degree, building it out, but it's a matter of effort. So, we haven't talked about housing, but I think there's a real analog in housing. So we have some good programs. We have some affordable housing being built, but we need so much more. And I think it's the same thing. And I don't mean so much more in terms that it's going to cost so much more money necessarily, but it's so much more effort, so much more focus on ensuring that people have health care, that people have a place to live, and that the kind of prosperity and growth that this government is preaching is actually available to everyone, not just some people.
Okay, Claudia, lots and lots, and we could talk for a very long time. There's no end in sight of issues. Well, let's chat before the year end, okay?
No problem. Thanks a lot, Todd.
All right, take care. Claudia Chender, leader of the NDP. Enough is enough. Ottawa hike student visa